Hello, my name is Kathy Korwin and I am the public health nurse for Princeton Health Department. Close contacts are individuals who are within 6 feet of a lab-confirmed COVID-19 case for a prolonged period, which is considered 10 minutes or more. And they've had direct contact with infectious secretions of a COVID-19 case. In other words, they were sneezed on, coughed on, possibly touched the same surface. Walking past a lab-confirmed COVID case or just being in the same building does not qualify as being a close contact. If a person does have a positive test, I did want to talk about the time frame for self-isolation and quarantine. The purpose of quarantine is to keep people who might have been exposed to COVID-19, but they're not sick, away from others. So if a person is a positive COVID-19 case, we want to keep the individuals away from them. If you're sick, we then put the person in isolation. Isolation is to keep sick people and those infected with COVID-19 virus away from those who are not infected. This also is for a person who is asymptomatic but has a positive COVID-19 case. They will then be put in isolation. Self-quarantine and isolation reduce the spread of COVID-19. Any person getting a COVID-19 diagnostic test should quarantine until they know the results of the test, unless otherwise directed by those administering the test. But basically, if you feel the need to get a test, you should quarantine. These recommendations are not for individuals who got a serologic test, an antibody test. So if you're symptomatic and you tested positive, you will isolate for 10 days since symptoms first began and 24 hours, 1 full day of fever-free without the use of fever-reducing medication. That is the least amount of time that you will spend isolated, even if you feel better. Household contacts are individuals who live in the same house as a lab-confirmed COVID-19 case. If a family member who is at college and hasn't been home, they're not considered a household contact. It is the people who are living in your house at that time. But if they don't live in your home and if they weren't exposed to the positive COVID case, they're not under consideration.